Hi, I'm Dr. Ahmed, NHS GP, medical school admissions expert and a medical school tutor. Can doctors lie? It's an interesting question. Doctors are ethically and legally expected to tell their patients the truth. It's essential for trust. This is the foundation on which rapport is built. If you don't trust your doctor, you're not going to open up, you're not going to follow their advice, you're not going to engage in their treatment plan. Doctors have a duty to be honest and transparent. This is deontology, duty-based ethics. Telling the truth helps patients make informed decisions, so it's part of autonomy. It's also non-maleficence, avoiding harm and beneficence when you're acting in the patient's best interest. But as any doctor would tell you, there are situations where we actually may withhold or modify what we say. And I wouldn't call this lying, which is really something where you're intentionally trying to deceive someone, but rather using professional judgment, modifying information in the patient's best interest. So, for example, if you're disclosing certain information and you feel as a doctor that that can cause serious psychological harm to the patient, let's give an example, someone has cancer and they're very vulnerable mentally in that moment, and telling them the prognosis at that time could lead to self-harm. So what I might do is I may wait for a better opportunity. I have to be transparent. I would tell them at one point, so this is a temporary situation, or I might adopt a more gradual disclosure to help them process. Another situation may be if they lack capacity, I may not tell them the information, but instead tell them to someone who is their legal advocate. And this is defined in the Mental Capacity Act of 2005. There could be legal cases or situations where we may withhold information, such as in domestic violence. So if you are asked this in an interview, it's not so straightforward that doctors must not lie. I would refine the word lie, what it means, and reinforce that any intentional deception for personal reasons would be unethical and it could breach GMC guidelines. But doctors may adjust their communication or the truth or withhold information to prevent serious harm. Now, these are exceptions, not the rule. Otherwise, honesty and transparency are absolutely fundamental pillars of medical ethics.